Hello, my name is Christina Vella, and today, through the use of the teaching strategy of demonstration, I will be demonstrating accessing an implanted venous access port, or Mediport. The reference group for this demonstration would be new nurses on a medical oncology unit in a hospital setting. Indications for a Mediport would be any patient who needs long-term IV therapy, frequent blood transfusions, frequent lab draws, or to protect their veins from chemotherapy or other vesicant drugs. An advantage for the patient would be that the veins are protected, blood samples are easily obtained without multiple needle sticks, and also they can get mass transfusions or even bone marrow transplants if needed, as well as chemotherapy while protecting their veins. There are two types of Mediports that are implanted in a patient. There is a single lumen, which just has access for one, or there's a double lumen where they can actually have two items infusing at one time, such as two antibiotics that maybe can't mix at the same time, or maybe they're going to have two chemotherapy drugs infusing at the same time. Usually you'll see the single lumen Mediport, but to ensure, you need to ask your patient beforehand what they have implanted. Alright, the supplies needed to access a Mediport are going to be a central line dressing kit. Each kit's going to look different hospital to hospital, but this is the one we'll use today. We have a 10 cc syringe of normal saline, sterile normal saline. We have caps that will go on the actual Mediport needle. These are also sterile. Huber needles, and I have two different sizes. I have the 3/4 inch and the 1 inch. And once again, to determine what you'll need, you can ask your patient what they normally use, or you'll have to look at the patient to see what kind of needle you'll need. And you'll determine this by palpating the actual Mediport. Okay. The other supply we'll need is, if you're going to be obtaining a blood sample, would be a sterile, empty 10 cc syringe. And then also I bought some sterile towels, and this will help make your sterile field a little bit larger, because the sterile field that comes with the pack isn't always very big. Next, we'll prepare our patient for our accessing of the Mediport. Today we're going to use Chester. This will be our patient. Okay. So what you're going to do is you're going to explain to the patient the procedure, accessing the Mediport. The best position would be to get them laying flat. This allows for easier palpation of the Mediport, and also because you have to use a 90-degree angle, it's easier to be over the patient instead of having them sit up. Because if you have them sit forward, sometimes it's hard to do access for the Mediport. Okay. We're going to set up our sterile field now for the Mediport access. We're going to start by opening up our sterile towels. And we're just going to use one towel from this set. And you don't have to have sterile gloves on for this part, not just yet. What you'll do is, you'll open up your sterile towel, and like I said, this creates a larger sterile field for you to work on. Okay? You can put your saline, decide which needle you're going to use. So for our patient, I've already determined that we'll use the 3/4 inch needle. So I'll open it and just drop it on the sterile field. Okay? I'm actually going to open our central line dressing kit. And in the central line dressing kit, the specific supplies that will come in this are a mask that you'll wear to protect you and the patient, okay, a package of sterile gloves, gauze, which I'll just throw on the corner here. You'll have chlorhexidine swabs to cleanse the patient. You'll have a transparent dressing to put on top. And you'll have a bio patch. The bio patch is a patch with antibiotics in it that actually keeps the chance of a Mediport or blood-acquired infection through that line. It cuts the chances down. So I'll just drop the bio patch down. Okay, and that should be all you need. So next we're going to get ready to cleanse the site. So generally speaking, your patient will have maybe a gown or a t-shirt. And what you want to do is, if it's a hospital gown, of course have them move the gown, either flap it down, or you can actually have them remove the whole gown. Or if they have a t-shirt, they can pull the t-shirt up and move it over one arm so that the area of the Mediport is exposed. Okay? You'll also let the patient know to turn away from the site that you're accessing because you don't want them to cough, to breathe after you've cleaned the site, because you want it as sterile as possible. So for instance, we will have told Chester if he can turn to the right side because the Mediport we're accessing is on the left side. Okay? I'm going to get my gloves open and ready. Before I put my sterile gloves on, I'm also going to open the fluorhexidine swabs and have that ready just to pull. We're also going to take our saline and attach it to one of our caps. Okay. Now without touching the cap, if you still don't have gloves on, if you just peel the wrapper back and attach it, what you're going to do is prime the cap. Okay. So you can see we've primed it with the saline. Okay. All right. So next we're going to put our mask on. Now, if the patient's not sure and they think they may have a chance of either sneezing or coughing, you can also mask the patient. For these purposes, we'll just mask myself. We'll put our sterile gloves on. Okay, once your sterile gloves are on, you're going to take your cleaning solution. Okay, and you're going to palpate where the port is. So you're going to be able to feel through the skin where it's at. For these purposes, I'm going to exaggerate so you can see where the port is. You can see the circular grid. So you're going to clean in a clockwise motion. Okay. You're going to allow it to dry, and while it's drying, we're going to get our needle primed. You'll take the cap off. You'll attach your cap, and once again, you're going to prime the saline. Okay. You'll take the safety cap off, and you can see the Huber needle now. Okay. Okay, now that the area is dried, okay, I'm going to wipe it off just for teaching purposes, but you'll let the area air dry. Once again, you're going to palpate the area. You're going to feel the center where it's soft, okay, and kind of holding in place so you know the margins of your Mediport. Using a 90-degree angle, you're going to go straight down with the needle. Don't go this way, you have to go straight at a 90 degree, okay, and push down with. The patient will feel a little bit of pressure. And what you're going to do is you can flush a little in and actually pull back. Normally you'll see blood flow if it's in the right position. If you don't have blood flow, but you're able to flush, you may have to use TPA or heparin after you've accessed. So we're going to assume we've got blood return. Okay. We're going to take our bio patch and putting the blue up to the sky, we're going to put the bio patch under the needle. Okay. So that antibiotics are now touching the actual skin. Okay. Now the gauze that was in the kit, what you can use is you can make a pillow. Sometimes patients have a little bit of a gap between the needle, and so that you're not always putting pressure, by putting a little cushion underneath, you make sure the needle stays in the correct position. Okay, so we're going to take this part off. Using our transparent dressing, we're going to peel it, place it securely over the Mediport. And I usually leave the tail up. That way when they put a gown on, we can still access it. You'll peel it, and the Mediport's now secured. That's how to access the Mediport.